Hello, everybody. This is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Very good questions. Once again, Dr. Bob, what causes ridges on the nails and how can I get rid of them? I have commonly seen and I have learned over time the adrenal glands have a lot to do with ridges on your nails. The adrenal glands have a hormone that's a part of their cycle called a mineral corticoid. A mineral corticoid helps the absorption of minerals. Now there's sometimes a person can have more of a scoop type of a larger ridge that is due to anemia. And just one other thought when it comes to your nails, you want to make sure that you can see the little white moons on the lower part of your nails because that has a lot to do with oxygenation in your body. And sometimes they'll tell us if you could have some heart distress. You may want to increase your minerals, Celtic Sea Salt. That'll help your adrenal glands have the minerals that it needs to support optimal body function. If you have a lot of stress in your life and your pH is acid, that also will cannibalize minerals. I use Celtic Sea Salt liberally on all of my food. Question number 2. This is a very first time question. What can I do to stop arthritis? Well, I have learned, once again, over time, the liver has a lot to do with joint function and arthritis. Let me give you an example. There's a skin condition called psoriasis. There is a form of arthritis called psoriatic arthropathy. It's okay, what did you just say, Dr. Bob? What I have learned, the liver has everything to do with skin problems. So let's say you have a compromised liver, let's say you're drinking a lot of alcohol, taking a lot of medications, and your liver's not up to par. I have seen the liver has a big important factor when it comes to skin and joint. Now, there's a lot of reasons that you can have, there's lots of different types of arthritis. There's rheumatoid arthritis, there's wear and tear arthritis. I've even had people having large knuckles reduced in size by cutting back on dairy. So it almost would need to do an assessment, some blood chemistries, different kind of blood tests can be very specific, so what your problem could be, and even a food sensitivity can cause joint inflammation, and one of the reasons you may consider doing the FIT test. Very good question. Last question, Dr. Bob, is there something I can do to fight off the feelings of anxiety and depression? Well, I want you to know this is a very common question and one of the reasons that I wrote Dr. Bob's Drugless Guide to Mental Health. Now, we could talk hours about anxiety and depression, but what I have learned, oftentimes people with anxiety might need B vitamins, especially vitamin B1 or thiamine. Now, because you're watching this right now does not mean you run out and buy the B vitamins, because there's different questionnaires that we ask, blood chemistries, but a lot of times anxiety individuals have heart palpitations and they are really stressed, and whatever we seem to talk to them about, it's never enough, but minerals and B vitamins. Switching gears to depression. You know, I wrote Dr. Bob's Guide to Stop ADHD in 18 days 20 years ago. And what I learned in that time, that a lack of oil was one of the leading causes of depression and ADHD. And science has advanced so much over time that we could, with the help of blood chemistries, once again, let you know the exact level of DHA in your body. DHA is the fat for brain health. I may encourage you to get Dr. Bob's Drugless Guide to Mental Health. Actually, you could go to our website and buy the chapter on anxiety and depression. And it'll help you do some of your own research to get to the root cause of what's going on. I'm Dr. Bob DiMaria.